Hello guys, in this video we're going to talk about the bad breath. So bad breath, it is also called halitosis. So this is the medical term we use for bad breath, and bad breath can be sometimes embarrassing during social gathering or when we are with friends or when we are on date. So in this video we're going to talk about the causes of the bad breath and also some treatments of the bad breath. So if you are new on this channel, please like and subscribe. That would be highly appreciated. And let's get started. So bad breath, it is also called halitosis. This is the medical term we use for bad breath. And let's see the causes of the bad breath. So there are various causes of the bad breath. So the most important causes is the types of food that we eat. So the types of food we eat mainly produce bad odor, such as garlic, onion, spicy food, and they have a lot of sulfur in it and which have strong smell. So the types of food that we eat determine the types of breath. So this sulfur containing food such as garlic, onion, or spicy food, they have highly tendency of developing into bad breath because when they get metabolized they get into the blood, and this can lead to the bad breath. And the next one is poor oral hygiene. Of course, when you have the poor oral hygiene, it can really leads to bad breath. So if you don't brush daily and also don't floss your tooth, food particles remain in your mouth, which helps to grow bacteria. And first it develops into plaque, and if you don't brush for a long time, then this turns into hard calculus. So this is the best place for bacteria to grow. So as you know, when you don't brush, the food particles, they remain in the teeth, and then bacteria grows rapidly in there. So eventually it will turn into plaque and calculus, and this is the best place where bacteria can grow and multiply, and this can leads to poor oral hygiene and bad breath. And the next one is tobacco and smoking. Well, smokers and tobacco users are more likely to have poor oral hygiene, and poor oral hygiene leads to more plaque and calculus, and this provides suitable environment for bacteria to grow and multiply, and eventually leading to bad breath. And also dry mouth. Well, dry mouth can also lead to bad breath. As we know, saliva helps to keep the oral cavity clean. So if the mouth is dry, then this changes the nature of normal oral flora. Here the normal oral flora are normal bacteria that is found in our mouth, and if they increase in number, then they bring oral problems like caries, gingivitis, and produce foul breath. So when there is a dry mouth, the number of bacteria in our mouth increases and multiply rapidly, and as they multiply, they also bring the oral health problems like caries, gingivitis, and eventually leading to bad breath. And the next one is medication. Well, some medication can also contribute to bad breath, such as atropine. So atropine is a drug that is used to decrease the rate of salivary flow, and when we are in such medication, this may lead to the salivary flow in our mouth, and eventually leading to bad dry mouth, and it leads to poor oral hygiene and bad breath. Also, infection in the mouth can lead to bad breath. Infections such as tooth decay, gum disease, mouth sores are great source of bad breath. As we know, infection sites are the place where there are numerous bacteria, and they grow rapidly in number, and they produce pus or destroy the tissues, and eventually leading to bad breath. Also, fasting and crash diet can lead to bad breath. While fasting and low carbohydrate eating routine can lead to bad breath. This is due to breakdown of fat resulting in chemicals called ketones. These ketones have strong aroma. So when we are in crash diet or fasting, our body develop into a system that helps to break down the ketone bodies. So these ketone bodies helps to produce energy, and also these ketone bodies, they have strong aroma, and as they have strong aroma, they eventually leads to bad breath. And other diseases such as nose and throat infection, cancer, GERDS. So the nose and throat infection, as they are close to the mouth, so eventually leading to bad breath. Also, cancer of oral cavity can lead to bad breath, and GERD, it is the stomach disease that can lead to bad breath. Also, if you have kidney and liver disease, you may have fishy smell. So how to know if you have bad breath? Well, if you visit dentists, they can tell you if whether you have bad breath or not by examining your oral cavity. So also you can check your breath by yourself. Just lick the skin of your hand and wait for a few seconds, like 2 or 3 seconds. Now smell it and decide whether you have bad breath or not. So you can tell by yourself if you have a bad breath. You smell like some pungent smell coming out of your skin, and if you don't have such type of smell, then your oral cavity is normal. Also, you can ask your trusted friends and family about your breath. Now let's see the treatment of the bad breath. So the first one is the practice good oral hygiene. So this is the most important thing to keep away the bad breath. So just brush twice a day with fluoride containing toothpaste. So this fluoride helps to prevent the caries, and brushing tooth twice a day helps to remove food particles and plaque. And it is very important to scrape the tongue after brushing, because tongue, it has many micro crabs, and this provide best for the food retention and bacterial growth. So where there is a food retention, the bacteria increases their number and multiply rapidly, eventually leading to bad breath and poor oral hygiene. So it is important to scrape the tongue after brushing. Also floss the teeth, and also replace toothbrush at least once in 3 months. And also you can use antibacterial mouthwash such as Listerine, Povidone iodine mouthwash, or chlorhexidine. So just use them twice a day, and this helps to keep the bacteria number very low. And also do not eat anything for at least an hour after mouthwash. And the next one is the wash your denture every day. So if you are using a denture, make sure to take them out and clean before you use. And avoid dry mouth. So if you're suffering from dry mouth, you can use sugar-free candies, gums to stimulate saliva. And in some chronic cases, artificial saliva can be also used. And also avoid uses of tobacco, smoking, cigarette, drinking alcohol. These items can lead to dry mouth and poor oral hygiene. Also drink a lot of water to keep the mouth moist, and avoid a lot of sulfur containing food such as onion and garlic. These foods such as onion and garlic, as they belong to sulfur containing food, and the sulfur has very pungent smell or strong smell. So just if you are suffering from the bad breath, just try to avoid them. Also visit your dentist. Make sure your dentist and restoration have proper fitting, because if they are loose, and there is a high chance of food accumulation. So as there is a food accumulation, this leads to multiplication of bacteria and plaque. So just make sure your denture and restoration have a proper fitting. And also do scaling every 6 months. And also treat your dental disease such as caries, decayed tooth, gum disease. So if you have such disease, make sure you treat them. So that was all about the bad breath. So if you like, then subscribe to my channel, and feel free to ask question in the comment section.